My name is Luke Cascarini. I'm an oral and maxillofacial surgeon. I specialise in treating conditions of the TMJ, that's the Temporomandibular Joint. I look for the range of movement of the jaw, the type of pain patients have and when they have the pain. And I look at other factors including underlying medical problems, whether they have other types of arthritis, and also quite a common problem, particularly in younger patients, is hypermobility and the spectrum of Ehlers-Danlos syndrome, which is a special interest of mine. A lot of patients who come to me with TMJ problems have clicking, sometimes locking of the jaw, by which I mean they have a difficulty opening the jaw and the jaw feels as if it's stuck closed, and that's called a closed lock. Patients quite often have quite constant pain, often made worse with eating and yawning. Usually my first line investigation for patients with TMJ problems would be to undertake an MRI scan. That's a very detailed imaging which shows the joint in function, open and closed, shows the position of the disc. It can show if there's degeneration, that's wear and tear, but it also shows if there's inflammation, such as you'd get with rheumatoid arthritis, etc. And it also doesn't involve any radiation, so it's a very safe type of imaging. A lot of patients will start with a bite guard made by the dentist, and that can be very helpful for people who are clenching and grinding their teeth and have a clicky joint. But sometimes they might have persistent muscle pain, in which case adding Botox to their treatment can be very helpful for that. Other patients, for example, could have damage within the joint, and for that, usually we start with anti-inflammatory type drugs and physiotherapy and resting the jaw. But if problems persist, then sometimes an arthroscopy can be very helpful. Arthroscopy is a very straightforward procedure. It does require a general anaesthetic for proper arthroscopy, but it can be very helpful diagnostically and also therapeutically. And as part of the arthroscopic procedure, further medications can be placed into the joint, including steroids, local anaesthetic, and also lubricant type substance. That can be very helpful. Furthermore, more advanced arthroscopic techniques, including reducing a displaced disc within the joint and fixing it in place, can also be carried out arthroscopically. And these are day case procedures. The new biologics are incredibly exciting for TMJ surgeons because there's a huge gap for patients between arthroscopy and joint replacement. And if you have TMJ damage and you've tried basic arthroscopy and you've tried medication and it hasn't worked for you, there is very little, in fact there really isn't anything available that's proven to be effective to improve your problem other than joint replacement. And I feel that's a huge leap to go for a patient from an arthroscopy to a joint replacement. And that's why I'm so excited about stem cell treatment, because it's working fantastically well in the other joints of the body. I can't see any reason why it wouldn't work in the TMJ, and I'm really excited to be able to start trialling this with my patients who have had basic, simple techniques and still have ongoing problems.